So you have the two terms. I give you the two terms. The one is called seizure. Another term most of you are already familiar, and that is called as the epilepsy. Got it? Now there is a difference between the seizure and epilepsy, but most of the time we thought that the seizure and epilepsy is the same just because they have the same symptoms. I am agree with you, but again, incidence matters. How much times they are occurring, that matters. That basically classifies the diseases. Okay, so in the case of seizure, what is happening inside our brain? You already know that there is a presence of neuron. Fine. Now these neurons, they communicate with the other neurons. As you can say, the cell number wise, we are billionaires. We have 89.1 billion neurons in our brain. Fine. And each neurons communicate with the other neuron in order to function smoothly. One neuron communicate with the other neuron, other communicate with the other neurons. So there is always a communication between the different neurons, and these, you can say, this communication is mediated by the electrical activity. This electrical activity which is occurring in between the neurons or inside the one neuron, that is, you can say, contributed by the ions. That is contributed by the ions like the sodium ion, calcium ion, and potassium ions. Fine. So sometimes due to deficiency of these ions, or due to the deficiency of the, you can say, the energy currency, the fuel, the glucose, hypoglycemic condition, these lead to what? They exert the stress on the neurons. Neurons are not properly communicating just because of the lacking of their, you can say, the prerequisite requirements, like the as I said, like the electrolytes or their energy currency. Cell have the stress. Basically neuronal cell have the stress, so they start firing abnormally. So abnormal electrical discharge. Now what happens if there will be an abnormal electrical discharge in the brain? Now once there is an abnormal electrical discharge in the brain, it means now brain function is really compromised. It is compromised. So it compromised in the three level. Okay, in three ways. The first was is a sensory problem. Okay, person not perceive the things correctly or accurately. They have you can say problem in the sensory. Apart from that, they have the problem with the motor skills, the motor functions. We know generally we are walking, talking. Okay, apart from that, we have the fine hand movement. Okay, we have the gross, like the catching a ball. These all things are the motor function. Okay, so these motor functions, they are also compromised when basically our neurons fires abnormally. So sensory problem, abnormal, you can say, motor problem. Apart from that, in the most of the patient with the abnormal electrical problem, or you can say the epileptic foci in their brain, end up with the cognitive, you can say, the abnormalities, cognitive problems. Cognitive problem means they have problem in the thinking. Now you have the rapid, you can say, the electrical firing inside your brain. How can you think smoothly or calmly? You can't, just because of there is a, you can say, problem in the neurons are not in their proper electrical positions. Okay, the current is high. Okay, so there will be a problem in the cognition, there is a problem in the sensation. Apart from that, there is a problem in the motor function. Got it? So these three problem occurs in the seizure. Now that's a fine, amazing. Now I am understanding. But what about epilepsy? Epilepsy is, my friend, something different. It is like you can say spontaneous. Spontaneous means anytime, any state it comes. Okay, it doesn't need a electrolyte deficiency only. It doesn't need the hypoglycemic conditions. It's anytime come. Fine. And it's a recurrent. Recurrent means one time it came, again it came, again it came, again it came. Okay, so there is a recurrency related with the symptoms, and that condition is called as the epilepsy. So you cannot label the seizure patients as a epileptic patient. Now this differentiation also help in the management. Okay, there is a different protocol for managing the seizure, and also there is a different protocol to managing the seizure. Fine, no problem. Now